HHS Secretary RFK Jr. is sounding the alarm on ticks.
Doctors diagnose 476,000 Americans with Lyme disease every year. This spring, Americans visited an emergency room for tick bites more than any other time in history. A clear sign that this threat is growing. Lyme disease affects all 50 states.
And he's right to be concerned. CDC data shows tick bite-related ER visits are at their highest level in nearly a decade. And it's not just ticks, as mosquitoes are also causing concern. They spread the dangerous dengue disease, with cases jumping 359% in 2024. Meanwhile, EPA Administrator Lee Zeldin is squashing online rumors that the agency is releasing mosquitoes. We've got a lot of questions, so we got the perfect person. Joining us now is HHS Principal Deputy Assistant Secretary and Director of National Health Communications at the Office of the Surgeon General, Stephanie Haridopolos. Stephanie, you have so many titles and you've earned them all. I want to jump in because this has been all over my feed with a lot of conspiracy theories. Folks are very concerned about the ticks. They think it's some kind of conspiracy. I've seen a lot of reporting that there are tick boxes being dropped at farms and ranches across the country. They feel that this is not just a natural uptick. They feel like something is being manipulated here. So I want to give you a chance to address those conspiracies, perhaps put our mind at ease. What is really going on here?
Well, thank you for the opportunity to use your platform to educate the public. Before we go into that, I just really want to look, like, bottom line up front. Let's talk about what Lyme disease is. After all, May is Lyme Disease Awareness Month because the season starts in the late spring and through the summer, right when everyone is going out to enjoy the great outdoors. Yes, it is true that the tick population has increased. It was confined to the Northeast. Now, actually, it can be found all throughout the United States. Now, Lyme disease is when you get bit by a tick and you get a bacteria that causes a disease. And that can start with fever, chills, rash, headaches, body aches, joint pain. So if you do get bit by a tick, please go to your doctor and be checked out. Now, your concern is valid, and I hear you, but I do want you to understand that we at HHS are doing everything through the leadership of Secretary Kennedy. I don't know if you know, him and his family, because they're from the Northeast, actually have been afflicted with Lyme disease. So he has put it front and center with a green light issue for us to figure out how do we prevent it, how do we then early detect it, and treat it. And as you saw with the announcement yesterday in New Hampshire, a lot more funding is going towards that right now as we speak.
Back to the original question, why the uptick? Why the numbers going up? Why is it so much bigger of a problem this year than last year? My daughter contracted Lyme disease 2 years ago from a tick in Georgia. I grew up with ticks all over me. If I ever got it, no one ever told me about it. Why does it seem like it's worse, or is it not worse?
Well, I'll tell you, the ticks feed on the deer. The deer are multiplying and they're running. And the white-footed mouse is the carrier of the bacteria. And so, unfortunately, whether it be the weather or the moving of the white-footed mouse and the deer is changing and the borders are increasing. I really want clinicians to think about, not only in the Northeast, but anywhere, if someone comes with symptoms, not just around when they got a tick bite. Not everybody knows they got bit by a tick, by the way. It could put it on your differential diagnosis. We need to get clinicians to start diagnosing it and treating it rapidly. You know, there are many factors. It's multifactorial. It could be that there's so many people going to the ER because we are doing a good job with awareness. But what we know is 31 million people a year are being bitten by ticks, and 500,000 unfortunately get Lyme disease. And I think that number is even skewed lower because the diagnostic tests are not that great, meaning the false negatives are high. We need better biomarkers, and we are working on that right now in real time, and of course, better treatment. So Secretary Kennedy is so dedicated to solving this problem during this administration.
And I believe that he is Assistant Secretary, but I got to address this because I don't want conspiracy theories going wild on social media, and I don't want some of these questions to go unanswered. We know how social media is, right? But sometimes we find that there's a kernel of truth to every larger conspiracy theory. So this notion that somehow there are ticks being planted, that there are ticks being put out by the government, that's what people are seeing on their timelines. They're getting very concerned. They're linking it this way and that way, and it's leading to a larger discussion online. So can you address that conspiracy so that the folks at home can have a better understanding, and so that their mind is maybe put at ease as to the government's involvement in this uptick in ticks?
Well, I have no insight to putting out boxes with ticks in it, not under my purview. But what I could tell you is in the Northeast, they might be putting feeding boxes out for actually the white-footed mouse to eat it, and maybe they would have an antibiotic that would prevent the mouse from actually getting the Lyme disease. That could be happening with the National Centers of Excellence in New England. That actually is not a bad idea, but we have to decrease the tick population. What you could do at home is cut your grass low. If you do go outside, wear protective clothing, have your pants tucked in your socks, use some D or permethrin. And by the way, there's going to be a new medication or over-the-counter spray called Nicotone that comes from a cedar tree that is more natural, that will be coming to market very soon for people who don't feel comfortable with permethrin. When you do get back in the house, shower off, look for ticks, pull them off, check your kids, check your dogs, of course, and put your clothes in the dryer so you can kill those ticks. Those are things you can do to prevent it in the first place.
Stephanie Haridopolos, we really appreciate you coming on tonight. You spurred a great discussion, and we appreciate it.
Thank you.
All right, now, when we were entering into this segment, Mark said, I don't really care about the ticks. And then we had a little side discussion in the commercial break about alpha-gal syndrome,
yes,
in which you get bit by a tick, and then you can no longer eat red meat. Now, these cases, to my knowledge, are also potentially rising.
Yeah.
So now I've got your attention.
Yes, you do.
So
if I can't eat red meat, I'm in trouble.
So now you're a little bit concerned. Listen. This is tick season.
Yep.
So when I talk to her about the conspiracies, it's not to scare people, but it is all over social media. So I think it's important when we have an official on to address some of these conspiracy theories so that people can know one way or another, or at least they can feel like they've got some answers. Joey, you said your daughter had Lyme disease. Mm-hmm. This is nothing to joke about. I mean, Lyme disease is very, very serious. Mm-hmm. I'm so sorry that she had to go through that. But is this something that you're seeing in Georgia? Are you hearing folks say, hey, we feel like there are more ticks this year, or are there rising concerns?
Yeah, I'll tell you this. They obviously must still be trying to figure this out because she didn't have an answer. She gave very general answers like I think she said the deer are moving more or the mouse are moving more. And then the next question is, why is that happening? The largest explanation here is that the winters are milder and the ticks aren't getting killed off as quick or as much. That might be true. Part of it, too, is the housing crisis. Housing crisis happens. There's a housing boom. Now we're popping up subdivisions everywhere. Every time you do that, you're introducing people into where the ticks are, into where the deer and the mice are. And guess what? When you cut a hole in a forest and put houses there, you don't reduce the deer population. You actually grow it because they're edge dwellers and you're creating food and dwelling for them. They're not living in numbers en masse in the middle of the forest because now the food they eat has to find a way to grow through the trees. When you cut open a field, now the food they eat is available. And so that's something that a lot of people don't understand. Mm-hmm. So it could just be simply that we're putting houses in so many places that the carrier population is on the rise. That's probably a big part of it.
Madison, just quickly, you said you know somebody who has this alpha-gal. It's nothing to mess with.
No, it's not at all. A friend's mom has alpha-gal. It does make you allergic to red meat. Very dangerous. She has been hospitalized 3 separate times, all from a tick bite. And then you think about Lyme disease, and as Stephanie said, if it's not diagnosed, people can go years, have issues. I had a former colleague that had knee replacement because she thought she had an issue with running. Turns out she actually had Lyme disease, and it was eating at her joints. So we need to have better awareness of these illnesses, especially if ticks are going up because of all these things. And it'd be great to have a cure or have real solutions if we're having things like, imagine if you couldn't eat red meat again.
Yeah.
I mean, it'd be terrible.
And she mentioned the diagnostics. It takes weeks to get a test back if you test for Lyme disease. They had to start my daughter on the antibiotics, not knowing if she had it or not, because they'd have to wait too long to get the test back.
And by the way,
Wow.
the federal government is releasing millions of mosquitoes.
That is true.
Franken mosquitoes.
Listen, I told you, Mark, this was going to be a hot topic.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.